Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So our topic today is families did their research. Now what? Health information seeking in the digital age. My guest is Dr. Rupal Gupta. She's a pediatrician and medical director of Operation Breakthrough. Dr. Gupta, welcome to the show.
Hi, thank you so much for having me, Dr. Mike.
So we're going to get into information seeking in the digital age because I know that's a challenge for a lot of practitioners. But I just wanted to hear quickly about Operation Breakthrough because this sounds really interesting. Just tell us a little bit about what you're doing there.
Sure. It's a very exciting place. So it is a early Head Start Center, which is based in Kansas City, Missouri. We serve around 450 children and are one of the largest daycares in Missouri. And Children's Mercy Hospital has had a presence in this center for the past 20 years, including a medical clinic which offers full well child care to families and also serves within the school community. So I was brought in as director of this medical aspect
great.
of the facility.
Very good, Dr. Gupta. I know you're going to do some awesome stuff there with Operation Breakthrough. Let's bring it back now, to this information seeking in the digital age, because I know this is a challenge, right, for hospitals and practitioners. What do you think are some common reasons parents and teens seek out information online?
It's funny because this kind of a thing affects, I think, all of us as providers almost every single day. We always have somebody who's looked up something in Google and is asking us about it. So we all know this on a very personal level. There are many reasons for which families will look up information online, and they make a lot of sense. They might have fear, they might have concern, they may have time and just want to have information on a certain type of a symptom. So many things can drive health information seeking behavior.
Do you find out or find it interesting that more people are usually it's after the diagnosis, right, that they go online? I know in the adult world, adult patients, when they get a symptom, they hop right online. But do you see that as with the kids, or do you see teenagers, for instance, after they've received, say, a diagnosis, that they sit down with their family and they start to go online? Is that the more common behavior?
I would say that this behavior, just like in adults, can happen at any time. Approximately 50% of health-related searches are done on behalf of someone else. It is more common to do health-related searching if you have a loved one, such as a young child who has a disease. So certainly that rate of search will increase once you have a diagnosis. But teenagers, for instance, may not have any kind of a diagnosis, but because of a symptom they experience, they might start exploring their social networks and the web to find out what it could mean.
Yeah. Well, what about when a parent or even maybe a friend of the family goes online to start looking up about a diagnosis or about symptoms? Does it concern you about which sources or resources they're looking at online?
Well, I mean, that's the obvious number one concern. When we have, in the pediatric office, the issue of vaccine hesitancy affects us increasingly. And being in Operation Breakthrough, I've tended to have patients who will trust and accept medical care, but I am seeing increased levels of vaccine hesitancy as, information abounds, but the quality of that information can be questionable. So that's one of the first things that I discuss with families when they have a question about a certain symptom. What are their sources and how are they evaluating them?
And so, Dr. Gupta, how do you actually approach that? I mean, we don't want to belittle the person. We don't want to say, why are you on that website, right? I mean, what's your approach to actually asking that question and evaluating the website they're looking at?
Of course. I think that, the first thing that providers might be inclined to say is, get off a search engine. You don't look up health information. And because of the ubiquity of information seeking in general online, we all know that that's an unrealistic possibility. So the current model that's often recommended is to ask, acknowledge, advise. So don't be afraid to ask the question, acknowledge the family's concern, and try to give them some concrete advice on how to evaluate those sources. Unfortunately, there's not data to back up the use of that particular model, but I'm afraid that at this point it's all we have. That as providers, as history takers, the more history we can take to understand our families' decision making and questioning, the more we can treat them personally and properly.
Yeah, it seems like if there's some information that the parent or even the teen has, and they're talking about this in their doctor appointment, and it's not coming from a legitimate source or a source that concerns you, isn't that just maybe a great springboard into actually educating the family, the teen, about what's really going on, about the symptoms? So it really could be something. If we handle it right, we can make it a positive. Correct?
Well, and certainly that can happen. I had an example of a patient who came into me concerned about their child having neck pain. The child was completely well and without symptoms otherwise, but the family had looked up a topic of chronic meningitis and thought that could be a concern. So I was able to educate this family on the fact that diagnosis isn't really a legitimate one, and help reassure them, your child does not have any rigidity of the neck, your child is not having fevers, your child does not have any signs of meningitis. And so you have a lot of reason here in this particular situation to see that your child is healthy and well, and that you don't have to be concerned about that particular symptom.
Digital health media applications are, it seems like new ones are coming out almost daily. Are there any applications out there that you find helpful? And are there some digital health media applications that you find that may actually not be so great to use?
Well, I think that, because this type of information is changing, as you say, extremely rapidly, it's astounding to me how many wonderful things are out there. At the NIH digital presentation that was given in 2015, there was even discussion of a program called Night Scout, in which families had actually hacked their children's continuous glucose monitors to be able to track glucose and send that information to their phones. There are issues with that. There's the benefit of being able to track a child's glucose, and then the other side of it is that this may have some privacy implications. So I think that every application can have positive and negative aspects to it. The key is really identifying how to use sources appropriately, how one can recognize that their own privacy could be compromised by their use of those programs. So really educating families on how much information they are sharing with others online, and how they are being critical of whatever media they use.
Yeah, it seems clear to me that it needs to be a team approach to this as well, right? So the practitioner needs to know what some of those great applications are and some of those online resources. Speak with the family about that. Create almost an online strategy for how they can learn information. So it really becomes almost part of the care, right? And that way, as a physician, you would know the sites they're going to, you would know the information that they're pulling up. So to me, it seems like it should be a team approach. So with that in mind, do you have some advice then for practitioners in helping their patients go through a lot of that online information and applications?
Yes. So there's specific things that you can do in terms of evaluating a source. So you want to make sure that you know what the funding sources are for whatever application it is or web program that they're accessing, because that can give you good insight into what agendas might be desired by whoever's creating that resource. Find out who the sources are for the information that they're getting. So if they're going to a particular site or using a particular app, who are their experts? Who are the people who are being trusted by that application? You want to get a good idea of how privacy is protected with any of these applications, especially with the rise of telemedicine. So these are certain things that I'll discuss with families depending on their needs.
Do you know if there's, speaking of online, an online resource, for instance, that already kind of lays out a lot of that information for doctors and patients, meaning, here are some highly vetted applications, online resources? These are the good ones. These ones are a little bit more questionable. Is there anything like that?
I'd probably have to go into more research myself to know that answer. But regarding certain types of media programs, like Common Sense Media is one that I will commonly discuss with families. It's a wonderful resource that just helps you assess all kinds of digital media. So that could be especially related to children's media. So if there are children's health-related media, that would be a wonderful place to go to.
Right. Well, let's end this way, Dr. Gupta. You're an expert in this, this information seeking in the digital age. What's your overall take on all of it? Is it good? Is it bad? Where do you see it going in the future?
I consider it good. It's a good thing when families have questions and are engaged in their health. It may be a difficult thing to know that a family doesn't necessarily agree or want to go by the practice that I'm suggesting, being in traditional medicine. But it is absolutely a good thing for families to want to make decisions. So I think that it's absolutely a good thing for families to be looking into their health care and to show that they actually have a true interest and engagement in their health care. One of the things that we all struggle with is engaging our patients and making sure that they're personally invested in what they're doing, that they're reading, and that they want to make that decision shows it. So it's up to us to ask families and let them teach us about the sources that they're using so that we can explore them.
Right. And of course, we all agree, Dr. Gupta, it's not going anywhere. The internet is going to continue to grow. The resources are going to continue to grow. And so I think it's best that we have kind of a strategy for dealing with that in clinical practice. So, Dr. Gupta, I want to thank you for the work that you're doing at Children's Mercy, and I want to thank you for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.